a local woman who faced a scary battle against cervical cancer. It used to be one of the most common causes of cancer death for American women. Coming up on today's Morning Medical Update, why she says time played such a key role in her recovery. And good morning. It is Friday, January 20th. I'm Jessica Lovell. Welcome to the Morning Medical Update. Cervical cancer is one of the most preventable and treatable forms of cancer, thanks to prevention and screening. Today, we're going to hear from a patient about her treatment and the current research and trials that could change the future of cervical cancer. Make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. In 2023, there are expected to be nearly 14,000 new cases of cervical cancer. That's about 200 fewer cases than last year. A study from the American Cancer Society found women ages 20 to 24 who were the first to receive the human papillomavirus vaccine showed a 65% reduction in cervical cancer from 2012 to 2019. The HPV vaccine was first given back in 2006 to females ages 9 to 26. We know that's changed. We'll talk about that in a bit. HPV causes more than 90% of all cervical cancers. We'll talk about that as well. But first, I want to welcome our guest. Erin Reyes is with us today. And it is Cervical Cancer Awareness Month, so we're so happy you're here and you're going to share your story with us. Erin was treated here for cervical cancer at the health system back in 2021, and we're joined also by her physician, Dr. Lori Spuzak, her surgical oncologist. How are you?
Good morning.
Always glad to have you with us, and your passion towards women's health is always shines through and comes through. So I'm very glad you're here to talk about this.
My pleasure to be here.
So let's talk about this, Erin. When were you first diagnosed? When were you first diagnosed? And then what were those initial symptoms that you experienced? I think, are you on mute, Erin? Okay.
Yeah. No.
Okay, now let's go. I think we can hear you now.
We can hear you.
Okay. No, sorry. I was first diagnosed back in March of 2021, and just symptoms included I started having a gush of clear liquid, and then what mostly scared us was bleeding during intercourse, and it was very scary for both me and my husband.
That would be really concerning, and I appreciate you just being really candid about those symptoms, because a lot of people don't always want to talk about that, but it's simply the reality. And I would imagine, Dr. Spuzak, the symptoms can present in different ways, and that seems really severe. So this is happening. You clearly know something's wrong. When did you reach out and try to get some answers on what was going on?
Well, I started to, when my husband, he was like, no, something's definitely not right. You gotta go. I went to my PCP, and that's when she saw like a bubble gum size lesion in around my cervix, or in my vagina. So.
We've got them. It's okay to talk about it. And I know it's not comfortable, but thank you. And this is why
I'm so appreciative that you're here to talk about it and be honest and candid. Thank you so much. We're so grateful, because so many women are afraid of talking about their body. And so I just have so much gratitude for you that you're willing to share. Yeah.
And we do, and that's why we do this show. But we can't do this program without patients that are willing to share their stories and be open, so that other women see this, Erin, and then go, wow, that's happening to me. So it's life-changing and it's life-saving. So yes. Thank you. I do want to ask you, though, Dr. Spuzak, you know, she was talking about these severe symptoms she was having. What other symptoms might someone be having right now that might be worth a phone call to your doctor?
Yeah, sure. I think abnormal bleeding, like Erin said, any type of abnormal discharge, pelvic pain, anything that is sort of atypical for you. But the truth is, a lot of cervical cancer is actually silent, and the best way to find out what's going on, or a pre-cancer of the cervix, is actually through screening. So a regular pelvic exam, pap smear on schedule per guidelines, which can change based on your age, but many times it's actually caught through the process of screening.
Okay,
Yeah.
you say cervical cancer is a slow progressing cancer. What do you mean by that?
Well, so what I mean is actually, so it's slow to turn into cancer. So the reason that screening works really well for cervical cancer prevention is that pre-cancer has a protracted course. It takes time to evolve into a cancer. And so that is why the Pap smear technology is so effective, because over the course of your life it can catch early changes, and then you are able to get further diagnostic workup and then treatment, hopefully before it turns into cancer. I will share, though, that there are some types that are very hard to detect, and some, especially on the inside of the cervix. There's cervical cancers sort of that start on the outside, and then there's ones that start on the inside. And those endocervical cancers sometimes can be a little harder to pick up on Pap smear. And so now we've added, for those who are above the age of 30, HPV testing as well to complement the cellular testing that we do through a Pap smear, and that can really help us also with detecting cancers.
All right, so I've been getting Pap since I was 18. You get them you would get them annually back in the day. Last one I had, it was now you need it every 5 years. I went, wait, hold up, 5 years? I thought it was every year.
Well,
so that concerned me.
Yes.
So tell us about that and what those changes mean.
So Pap smear testing has changed a lot, and basically they're trying to balance reducing sort of unnecessary testing, but also balance that with the rates and risk of cervical cancer. And so, for example, we typically start testing at 21 now, but we don't start HPV testing until your 30s, depending on which testing algorithm you use. Sometimes people start with HPV testing only at age 25. So there's different algorithms that people use for testing, and they've changed over time. So if you have negative co-testing, meaning you have a negative cellular test plus a negative HPV, then yes, for your age group, you can expand your actual swab test every 5 years. Should you still see a GYN for a bunch of other reasons, maybe once a year?
Absolutely.
Yes. And it's just like how we talk about, any kind of preventive care. Should you still see your primary care doctor? Yes. And even so, it is much better to catch things early before things happen, to talk about prevention, to talk about prevention options, than to catch things late, right? And so,
so it's been a minute since I was 18. So what you're saying is things have advanced and changed since way back then.
We have more information.
That's right. Erin, were you getting your regular Pap smears, though, since you were young, and this was something that was always on your schedule and your calendar?
Yes, absolutely. Every year I would go to do my yearly physicals and definitely get that taken care of.
Yeah. And I think, and I'll just point out, so if it's okay to share, Erin's particular type of cancer is the kind that starts inside the cervix. So sometimes we find that those are not caught as effectively with the typical swabbing Pap smears, and so sometimes they present and have evaded all of our standard screening technologies. Yeah.
But is it her specific type of cervical cancer that may have caused some of those extreme symptoms,
Sure.
the bleeding, of course?
Yes.
So I want to talk about the treatment, her treatment plan and your path. Dr. Swizak, I'll start with you because she had what's called a radical hysterectomy. So tell us the difference between a standard hysterectomy.
Yeah, a simple hysterectomy versus a radical hysterectomy. So when cervical cancer is caught early enough, meaning it hasn't extended out laterally, which it usually does, so it can spread into the vagina and into the tissues around the cervix, some folks are candidates for a radical hysterectomy. So usually when we do surgery, it sort of hugs the uterus and cervix for a simple hysterectomy. When you have a radical hysterectomy, we need to take a portion of the vagina and all of the tissues around the cervix and the lymph nodes of the pelvis, and it's a very high-risk surgery. About 1 in 10 women will have a serious complication, even in the best hands, because it's such a radical procedure. But it is the best chance for survival for very special candidates for this type of surgery, which Erin was one of those
you
candidates.
said it's high risk, but highly therapeutic.
Yes, that's right.
I want to talk about the HP vaccine. I have a 9-year-old. My daughter just received hers this past round of vaccinations. And Erin, you said you've got a 9-year-old. So we're talking about this a lot with our children, our daughters and our sons. Dr. Spuzak, though, let's talk about, you've been doing and treating this cancer. You've been studying this cancer. Here comes this vaccine.
Yeah.
You've always said this is the first vaccine that could prevent a cancer. You can never stress that enough.
Right, and I mean, which to me is a miracle. And the way that the vaccine first started, it only covered a certain, a smaller percentage of the high-risk strains. Now it covers the majority of high-risk strains, so that this vaccine can potentially prevent 99% of cancers if it's delivered effectively at the right age and before exposures to HPV. So it's truly life-changing, and I think that if folks could just see what I see as far as what cervical cancer looks like and the things that we have to ask our patients to go through, that they would definitely want to save their children from having that experience. And I'll also just echo, we've talked about this before, this is not just cervical cancer prevention, it's any kind of the genital tract, anus, the head and neck cancers. So we're preventing actually a tremendous number of cancers with this HPV vaccine. So it's a really big deal, yeah.
And it felt good getting my daughters vaccinated with this. I knew this day would come, and it was a good moment to know you're doing something for their future. Erin, what was that like for you? Talk about, were you vaccinated? I mean, I
was not. Actually, I didn't even know about the vaccine until I started having children of my own. And I guess I didn't really, it was kind of disappointing, because I don't think it was available back then, but
I don't think it was available during when you were of age, quote unquote, to get it, and so you would have been in sort of a catch-up group to get HPV vaccine. So
because who is in that catch-up group? Because I did ask my doctor, is that something people need to be getting?
I mean, can you get it up to age 45? You can, but really we want to emphasize that it works the best, and there's even more and more research coming out talking about even if you get it at a young age, potentially even like a single dose is effective. So it's like if you get it at the right age, which is really in that younger age group, then you can limit the number of vaccines potentially that you need to get administered, and then it has a better effect over time. So a more protective and a more robust immune response with the vaccination the earlier you get it.
Sure. And Erin, I want to go back to what you were saying. You're right. I was part of that group too. It wasn't around when I was that age, but our kids are. So tell me about that, and knowing what you know and what you've been through. Talk to other parents out there about why they should get this vaccination on the list for their kids.
Absolutely. So I have an 11 and a 13-year-old and a 15-year-old boy, and the rest are girls. And I definitely, through this whole experience, I would want them to be safe, and you do the best for your kids, and you want them to be safe.
Yeah.
What's this been like for you, Erin? Talk to us about it, and how, I want to know how you're doing, how you're feeling physically, and then just for someone else who is about to embark on this journey themselves, what words of wisdom might you have?
Well, I'm feeling really great and grateful for Dr. Spuzak. She's been great through this whole process. It's scary. It really is, and early detection is very important. It's your yearly screenings. I can't express that enough. I'm glad that I was taught just to every year just listen to your bodies, and I hope show all the women and the girls anything with your body is you have to go and get it checked.
Get it checked. All the girls and all the boys. We want to teach our boys that if there's something going on down there, just to say something. You know, we've all got
Absolutely.
one, we've all got them, and
Yes.
let's talk about it and feel more comfortable sharing the information.
Yeah.
I want to ask you, because aside from anti-vaxxers, you know, the vaccine had some controversy in the beginning. How have we moved the ball forward with that?
I mean, I still feel like our country has really fallen behind other high and low resource countries, and it is because of stigma associated with vaccination. We saw that during COVID too, and it's really hard to combat that. I can, in my own mind and experience, I can tell people what I see and what I do, but it's a very difficult thing to do to combat misinformation.
And I want to talk about we talk about the stigma of the vaccine. I want to talk about the stigma of HPV. You said if you are a sexually active person, that your chances of being exposed or having HPV
are huge.
Almost just, it's just there.
Right. They say sort of lifetime risk for males is 90%, and for women it's 80% if you've ever been sexually active. Why don't more people have cancer? It's because most of our bodies are able to clear HPV and the virus. Can we be reinfected? We can. And the other thing that's true is that there are like hundreds and hundreds of strains, and it's only a few strains that really lead to the cancers. And so most of us in our lifetime will have had HPV. Some folks who, for example, are immunocompromised for some reason, they're on chronic steroids or they have HIV. Some folks who are smokers. There are different ways that we decrease our body's ability to clear HPV infections, and some folks are at higher risk of persistent HPV infection and the consequences of those.
I want to take a quick break. I know you have a big case you're working on this morning, so we're going to have to wrap up. But I want to get to Dr. Dana Hawkinson, get a quick check on our COVID count before we head into this weekend.
Yeah, we don't necessarily have to take a break. We could talk about vaccines all day.
That's right. We'll keep you busy all morning.
It's a lifesaver for sure. HPV
Absolutely.
vaccine is a lifesaver for sure. Please get yourself up to date with that. Get your children especially vaccinated, both boys and girls. Very important. Right now, our COVID count, has been really variable the last week or so, 10 days. Right now, 37 active cases in the hospital, 8 in the ICU, 4 on the ventilator, 70 total. But, we did dip a little bit in the active cases. We're back up a little bit now to 37.
All right, I want to get to a couple headlines. Dr. Hawkinson, Uganda declares the end of the Ebola outbreak. So what was the driving force in stopping those transmissions? What do we know at this point?
Yeah, I think this was multifactorial. Number one, the response of the Ugandan government and the healthcare providers. We know this is very easy to transmit when you do have people in the hospital who are encountering those body fluids. But I think it was really those local things that they did, those local interventions to help reduce it. Also getting the word out, getting education. We know education was huge for this because some of these cases occurred in more rural regions, and so there was a lot of stigma about that. There was, still using local medicine people for that, but it was education. It was doing the right things locally, and we also know that for this Ebola strain in Uganda, it was Ebola, the Sudan strain. There was no treatment or vaccine for that. We know that they did start to roll out some trials of 3 different vaccines as well, hopefully, and we are expecting good results from that. I don't know that that had a big impact because it was just trials, but I think we will get some more information for that. Hopefully moving forward, we will have a vaccine or vaccines for Ebola Sudan, but also more importantly, it was those local interventions done by everybody on the ground there in Uganda.
All right, next headline, grabbing the attention of infectious disease doctors. The world's oceans were the warmest on record for the last 4 years, 4 years in a row. So it's certainly a sign of climate crisis. But how does the temperature of the ocean impact infectious diseases?
Yeah, it's not just one thing. So it is the temperature of the oceans, but that is also a bellwether for the temperature of the climate in general. And we are seeing warmer temperatures now reaching up into those northern climates. As those southern temperatures increase and rise, we know that there are temperature thresholds for certain species, so they will seek different temperatures. mostly going into those northern latitudes. It's just a lot of different topics right now that all come together to do this, as you have different species moving into different areas where they not normally are, whether that's vectors like the insects, the ticks, or whether it's the animals, the vertebrates like birds, bats. You are going to have more contact, the ability to contact different animals, different vectors like ticks or mosquitoes. And so I think it's just a variety of factors that all contribute to now overall our increased risk of getting exposure to maybe viruses we haven't seen before, or that we have but now are re-emerging for one reason or another. And to Dr. Spuzak's point as well about vaccination, we know that overall vaccination in the current vaccine preventable diseases that we do have will help overall in this, because we know and we do anticipate further exposure to, again, re-emerging viruses and pathogens that we already know about, but also those ones that we haven't really yet discovered or identified yet as well. So it's definitely a complex picture. I mean, we could do a whole hour on that. I know we have to move on with our show, but it is truly interesting, and we have to expect more identification of diseases or outbreaks as we move forward as well.
All right, I'm going to hold you to that hour program.
Yeah.
Special, infectious disease special.
Yeah.
All right. Okay, let's get to, well, first, do we have any reporters on the line? Nope. Let's get to our community questions. Good ones today. Question, Dr. Spuzak, I'm going to ask Aaron first, but what if my partner has HPV? How do I protect myself? So Aaron, you know, what were those conversations like when it came to your spouse?
Well, he was so supportive. He's been so great. He just was very concerned, and he just like, we got to go to your doctor. I was like, I agreed. I definitely agreed. I was like, yes. So I hurried up and made my appointment, and so he's just been great.
Were there any concerns about him wanting to be screened? Was he wanting to check his own health to make sure, you know, that this hadn't advanced for him as well?
Absolutely, yes, and he did. And he's fine. Everything came back fine. His blood work, everything, and so he did, because I wanted him to as well. So, but yes, he did.
So,
He did a
Yeah.
Go ahead.
So he did a blood test. So talk to me about that, so we understand.
So basically, the truth is, it's very hard to prevent HPV. Like, could you use condoms because as a sort of sexually transmitted infection context for prevention of HPV in that way? Maybe there's some effect and some benefit, but the truth is, HPV can infect all of the tissues and skin of the vagina, the vulva, the perianal region, the oral cavity. So the likelihood is it's hard when you have a long-term relationship or a coupling that you're going to prevent it with condoms. So the truth is, the best way to prevent HPV is to get vaccinated.
Okay, it goes back to that.
And so, the physical manifestation of HPV in a male is kind of only going to present if they get one of those downstream complications like genital warts or some type of cancer, you know. And so there's not a screening regimen or an algorithm for men that I am aware of, unless you're talking about sort of if someone has a known immunocompromised state. Sometimes now folks are working on sort of anal pap smear and HPV screening in that way, but that's still very controversial, and it's an evolving form of prevention strategy right now.
Angie wants to know, is HPV passed on through, we've talked about this on the show, touching other areas of your body. So you touch any sort of
intimate contact.
Intimate
is what
contact.
I would say.
So let's say you touch, because that's what we do in those intimate situations. But then let's say your hands. You know, if something does it travel on hands?
It can travel on body fluids. But then also you think like, warts are HPV, so like even if you think about your skin, not sort of genital HPV, but like it's through contact, and you have some kind of susceptibility, and so when
you get a wart on your hand, it is a strain of HPV,
but it's just not the particular anogenital
that's going to lead to a cancer.
Yeah.
Okay. And, well, I have one question came through here about when is the latest that a woman should have, what is the age that a woman no longer needs to have a pap smear? Kim wants to know.
This is actually really a complex question that you need to talk to your provider about, because it depends on what the results of your last pap smear were. Whether or not you've had a hysterectomy for a non-cancer related indication, whether or not you've had HPV infection. So there's actually a lot that goes into that. So there are really important algorithms that that are out there from multiple expert groups that tell you that, but it's individualized, so I can't tell you a particular age. You have to ask your doctor what your risk factors are and when.
So give us some good news. What excites you most when it comes to the future of treating this particular cancer?
I mean, we can eradicate cervical cancer if the population of young people gets vaccinated, right? So if the uptake of HPV vaccination was high enough, we could potentially eradicate cervical cancer. So there's something to look forward to if our population all got on board with vaccinations. The other things are treatment strategies. Actually, we have it is the best time, I think, in cancer care. It's like one of the most exciting times to talk about treatment, tailored treatment if you needed chemotherapy, radiation therapy, immunotherapy, actually new drugs for cervical cancer that have come available only in the last literally 2 years. So it's kind of this, it's an incredible time for treatment and for screening for all different types of cancers and prevention specifically for cervical cancer.
All right, I want to get to final thoughts for our guests. And Erin, I just want to give you a moment to share your thoughts, your words, and your message to anyone who's listening regarding your story.
Right. Again, like, you can't express it enough, just how just early yearly screenings early detection can just really save, like, your life, your everything. It's just early prevention, definitely.
And when you hear Dr. Spuzak say that it could be eradicated at some point, that must excite you as well, especially when you have your kids at home and looking towards their future, right?
Right, correct. It's very great. That's so great.
I always make her leave us with some really good news.
Yeah.
So again, I speak for Dr. Spuzak and myself and everyone here that we just appreciate you so much and appreciate you sharing and just being open. And we just wish you the absolute very best.
Thank you so much. I really appreciate being here and just spread the word. Definitely. Get vaccinated and everything.
I love it. Yes, absolutely. We have to get you on more kayaking trips like we saw in your pictures.
Yes, back to all those. I know.
Yeah.
Yeah. And thank you for sending those.
Yeah. Oh, thank you. Yes, thank you. It was, that was a good trip.
Yeah.
More kayaking and just, get home and be with those kids and you have a beautiful family and we want you to be well.
Thank you. Thank you. I really appreciate it.
Now I know why you recommended her joining us today. She's lovely.
Absolutely.
Your final thoughts today?
I mean, my final thoughts are get yourself, your partner, your kids vaccinated. I mean, I think one thing that we always talk about is like what are our fears associated with it. Really, it's the biggest risk is kind of allergy, like all of the other vaccines that we get. And the outcome, the benefit is so great. I wish, I always say this, I wish people could see what I see every day and how bad this can be. I only wish you could take a minute in my mind and see all of the things I've seen to know how much we really want to avoid cervical cancer for our loved ones. And so that's my takeaway. Is
you would love to be put out of work and retire.
I actually would be so grateful to be put out of work for cervical cancer because it's possible. It's possible. Yeah.
Always good to see you. Like I said, you're hard to track down because you're so busy, and we appreciate you being here. And I know you got to go on here in a moment. I want to get a quick final thought from Dr. Hawkinson today.
Yeah. How can we do anything but really piggyback on our guest today and just continue to emphasize the importance of vaccination. the overwhelming safety and efficacy of vaccination for preventing these things, preventing disease, reducing disease, and also preventing mortality, which is so important. We just have to understand what were things like before the vaccines for whatever we are talking about, whether that's measles, mumps, rubella, chickenpox. What were those disease states like, whether it's HPV and cervical cancer, and understand from that view of now the benefits of these vaccines and the overall safety, and just continue to endorse that and really try to be proactive in preventing disease for yourself and your loved ones.
Doc Hawk, thanks so much, and thank you all for being with us today. We'll see you back here Monday morning at 8 a.m. But between now and then, the Kansas City Chiefs kick off their playoff run. So on this Red Friday, let's share in all the excitement. And from everyone here at the health system, go Chiefs! Coming up Monday on the Morning Medical Update, the struggle is real as we enter into the high stakes and high emotions of the NFL playoffs. I'm Jessica Lovell. Coming up Monday on the Morning Medical Update, our clinical expert and former Chiefs player highlights the physical demands of this intense level of play as our sports psychologist tackles the mental toll. Join us Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.